Well, hello everybody. Dr. Frank DiLollo here. We're going to try something new and innovative here at DiLollo Chiropractic by sending you these video blogs. They'll last maybe anywhere from 2 to 3 minutes, 4 minutes, 5 minutes tops, I promise. And for those of you who are bombarded with emails constantly, we respect that very much. And if you don't want to receive these, you can unsubscribe down at the bottom of the page. Moving forward, what I want to kind of share with you is different topics that come up during the week or during the month here at the office. I get asked a lot of the same questions a lot, and I'd like to get this information out to you. We're going to call this video blogging, Does It Make Sense? Because I'm going to ask the question a whole bunch. Does it make sense to you that what I do in the form of maybe, let's say, lower back pain, neck pain, or headaches, those are the top 3 reasons people come to chiropractors, does it make sense? So some of you that are going to be getting this video blog are patients that are actively under care. Some of you have been patients before and are not under active care, and some of you are not patients at all. And we just know you because we know you professionally or personally. So hopefully there's something in it for each and every one of you, and we'll do our best to make that happen. Today we're going to discuss lower back pain a little bit further, and I'm going to ask you some does it make sense questions. So just in a moment we'll show you a little demonstration of that. So, as I said before, lower back pain is probably the #1 reason why people come to see chiropractors. You know, they don't know to see chiropractors for other things that are related to the nervous system, and we'll get into those in other video blogs that we send you. But today we're going to be talking about the lower back. A lot of people come in and they've got lower back pain, and maybe they've gone for an MRI and they've got a herniated disc or a bulging disc. And a lot of people think that they have to go for surgery. And sometimes surgery is the answer when the situation arises or the clinical findings state that basically that's what has to happen. However, there's a whole lot of things that we can do before that, before you have to go and have the surgery. Like I said, the video blog is, does it make sense? So does it make sense that, here's a spine. This is what basically I see when patients go onto the table here. I'm looking at the back of their vertebra. I'm looking at the different landmarks. Here's the pelvis, here's the lower back. Does it make sense that if one of these vertebrae or more than one of these vertebrae are out of their proper alignment, that it could be squashing or pinching or irritating or putting some kind of tension on that nerve? And as you know, a lot of people know the term sciatica. And the sciatic nerve is just simply a nerve that originates from about 3 or 4 levels in the lower back here and goes down and kind of runs down the leg. Does it make sense that if those bones are out of position where the sciatic nerve originates from, and it's irritating that nerve, that if we place the vertebra and the spines, the bones, back into a healthier position, that maybe we can relieve some of that pressure and put the normal position and normal positioning there and allow it to heal. For those of you who are patients right now, you know that we use the activator methods, and those of you who have been here before know that. For those of you who have not, we use the activator method. It's a handheld instrument, and there's a method of analysis to find out where the different bones are out of their alignment. So again, we're coming back and we're saying, does it make sense? If one or more of these spinal bones are out of their alignment, and we have a method of analysis of detecting that, and we also have a method of correcting it, does it make sense that we can put, if this instrument goes off at 1/10,000th of a second and puts motion into that bone, does it make sense that we can actually move that vertebra where it needs to be to open up those joints and open up those openings where the nerves are exiting and forming that sciatic nerve? That's as simple as it gets, and that's basically the premise behind what we're trying to do with a chiropractic adjustment, no matter what technique you use. And there's advanced testing as well that can find out these vertebrae can move in so many different directions, almost like a gyroscope. So we have to evaluate it and find out exactly which direction they need to go, and then simply place them in motion. Probably a pretty conservative approach, again, before doing any kind of more invasive type therapies. I hope that you enjoyed our video blog on lower back pain. I hope it did make sense to you. As we said, does it make sense? And if there's any one of your friends or your family or your coworkers that are suffering with lower back pain, by all means, please send them to us. That's what we're here for. We are here to help. I want to thank each and every one of you who have sent patients to us to take care of. I truly, truly appreciate it. It's probably the highest compliment that I can receive from someone that I take care of. So thank you for that. And be sure to tune in the next time, and we'll have other health topics on here, hopefully that are of interest to you. This is Dr. Frank DiLollo. Thanks.